Dr. Rita apa sudah bergabung?
Sudah.
Sudah, mana kita panggil Dr. Rita. Ini juga akan menjadi pemateri seminar yang pertama ya tentang envenomasi dari hewan berbisa kepada hewan kecil atau hewan kesayangan. Jadi yang belum daftar segera aja. Dr. Rita.
Hai.
Mana kameranya nyalain, please.
Oh ya, sebentar Bapak.
Oh iya, siap. Makanannya dihabisin dulu. Okay, there she is. Dr. Dita, Dr. Ferran. So Dr. Andita Hasni is gonna be the moderator of Meet Dr. Ferran #2 and the next Meet Dr. Ferran episodes, yeah. And tonight we will have Dr. Ferran with the materials of marine birds, introduction to handling, rehabilitation, and clinical procedures, right? So we're gonna move it to Dr. Dita to moderate this meet. Dr. Ferran, #2.
Okay, thank you.
Thank you. Good evening. Hello, we meet again.
You?
Ferran, how are you?
Very good. And you? How are you? Thank you for having me.
Great. Okay. So are you ready now?
Yeah, I'm ready.
Yeah. Please, you can start. Time and place is yours.
Okay. So let me check to share my screen.
All right.
Am I sharing my screen?
Yes.
Okay.
Would you please?
Okay, so thank you for having me again. It's a pleasure. And well, today I wanted to talk about something that maybe many other vets face sometimes. I mean, many of us have been working with birds for a while, but when a marine bird comes in the rescue center on the clinic, then it's like, oh my God, this is different. And it's not exactly the same kind of approach or handling that you would do with a parrot, with a pigeon, or with other kind of bird that comes in, right? Especially if you have some facilities and some places ready for them. I hope with this presentation you can get some ideas of how things can be done, and maybe get some stuff ready if you ever have the need to have one of these animals, right? I'm not also like the last presentation. Things that I say is not that they are the ultimate truth or something. It's just my experiences with them. I've been working with a lot of different animals, so I haven't focused only on birds. So I'm sure there will be around here probably listen to us many people who knows probably more, but it will be sharing some experiences that I think can be helpful for at least some of us. Okay, so the idea is to show the presentation in a way that is like in a line. When you have the bird in the wild, you try to capture it and you transport it to the clinic or to the rescue center. What kind of decisions you take then, what kind of facilities you have, how you feed them, and then some frequent problems that we face, right? So one of the main problems is that sometimes we don't know if actually the animal really needs our help or not. Often we get a call like, hey, there is a bird in the beach or in the rocks near the water that doesn't seem totally fine, but we are not sure. Then a process of observation is actually needed, because sometimes it can be normal that the animal is there. We need to understand what species are we watching, if it's normal that they are there, or maybe they are nesting in the area or not, or it's a baby or an adult, and of course observe if we can have some idea that something is wrong, like in the picture that we see that some fishing lines are around, or is hit by something, or has petrol on the feathers, etc. Right? Then we get with the we try to capture him. Then we face different situations. Of course, there is a lot of kinds of birds, and often we get pet birds in the clinic that, of course, they are pets. We have to be careful, but yeah, more or less are used to them, and it's a bit easier. But sometimes we have to handle animals that they never have been handled before. Not just marine birds. In the left, we see an owl that they need our help, but the approach we make to them can be very dangerous, not only for us, sometimes they can hurt us badly, but also we can make it worse to them. So it's good that before we act to the capture action, we see how are we going to do it, with what tools, and where are we going to go. Sometimes we can save some trouble to the animal, like in the owl on the left, we see that there is some barbed wire that can hurt us, that is entangled on the wing. And if we just approach, the animal will be very scared. They have powerful claws. Probably they can try, he will try to grab our hands. So we need to see where are we heading to make him less stressed and to catch him and handling as secure as possible. Depending the kind of bird, there is a lot of kinds, of you all know. They can hurt us in different ways. Sometimes, as we see a raptor bird, it's relatively obvious that the claws can hurt us badly, but we don't think much of other kind of birds like herons and this kind of long neck, long beak birds. The ardates is the name of the family. They look like, yeah, they probably will not bite us or something, but definitely they can be very dangerous. Many marine birds are like this, or at least water aquatic birds, and this long beak, they can and long neck, it can be actually very dangerous, because as we approach to capture him, many people has been hurt in the face or in the eyes because they prolong the neck, extend the neck very fast, and they can hurt you directly in the face or defend themselves with the beak, right? So it's something we need to see. And before approaching to any bird, a good advice is to think how the animal can hurt us, and then that's the first thing we need to immobilize. If we have a heron, like the picture up to the left, okay, first thing will be to immobilize the head, and then we focus on the legs. If we have a raptor bird, first thing will be immobilize the legs and then the head. So if we kind of approach like this, we will be safer. Not just for the animal and for us about direct bites and stuff, but also, as you probably all know, there is a ton of diseases that can be transmitted to us. So this is just a list. I'm not going to go one by one. There are probably several more, but in general, just remember that as wild animals, they can have some diseases that can be transmitted to us. So please have, in general, with all kinds of wild animals, basic hygiene protocols, to use mask, maybe we use gloves to separate from other animals when you bring it to the clinic, etc., until you understand what's going on. Okay, so we continue with the capture process. First of all, before going to here, I wanted to let you know that as we say marine birds, it's not just animals that live near the sea, but also there are some animals that they live very inside the sea, pelagic animals, and some animals that they live on the land near the sea or on the coastline. So each of these different groups of animals, they have very different way of maintaining them in captivity and characteristics. So that's why maybe not in the moment that you first see it, but as soon as you can, try to understand what kind of bird it is. There are some birds that they almost never touch the land, only for reproduction. There are other birds that they just like to feed near the coast, but they are very used to be on the land. So if you understand the biology of every animal, it will be much easier to make the rehabilitation a success, right? And similar goes for going before capture. If you have a bird that you need to capture, as well as any other animal that it's in a wildish area, and you need to approach in a way that he will not escape easily, and you need to just get ready with certain tools. In general, well, nets, towels, and gloves are the basic things. Basically, with almost, I would say, with a good towel, you can catch almost every animal. But definitely, if you need to approach to an animal that still can move relatively quick, that gets much more hard to do, even inside a facility. So it needs some planning. If you approach from, for instance, in the picture, low, if you approach from the sea side to the land side of the animal, then the animal will tend to escape in that direction and not towards the water. And then to have a plan of organized people to know what to do in each situation, and often it's not easy, and well, you need to be ready for things going south. Some examples to how to handle certain animals. Some animals will be easier, sometimes not easy at all. The anatids in general, if they are small size, is relatively easy. In general, any bird, you try to avoid them to move the wings so they can hurt themselves. And as we said before, to try that they don't hurt us or hurt themselves. But when they are bigger, that's not easy to do. Once you have it and you want just not to immobilize it, but also to have an exam, or to try to examine or check the animal. For instance, in this Sula bird, boobies, they have a very, well, potentially dangerous beak. The left picture, I show it because it can be a dangerous mistake to do. There are some marine birds that they do not have external nerves, because they are used to dive in the water, so they modified that. Some of them, they have it, but they close it. But in general, be careful when you close the beak totally, especially if the animal has some kind of respiratory distress, because that can be very dangerous for them. In general, when you handle a bird, try to cover the head and gently hold the neck. So in this way, you immobilize the head, but you always have the animal calm, and have the animal, if he wants to regurgitate, for instance, or to breathe, he can do it more or less normal. In the right picture, it's a general way to one person helps you holding the animal, so you then approach to examine the animal. Later we will go a bit through the clinical exam, what things to consider, and so on. Here is another example of how to approach to one of these ardate birds with long necks. So first try to capture immobilize the head, and as soon as you can, maybe with the use of a towel or not, to use the second arm to embrace the animal so he doesn't open the wings, and you can hold the legs with your right arm and try to have it immobilized, to move it to wherever is needed. Is everything okay so far?
Sure.
Yes, Ferran, it's so good. Keep
Okay,
going.
excellent. So we keep going. Those are just pictures to show example of how to do that. most of us use, as I said, I'm sure there will be vets saying, hey, but yeah, we already know that, but it's good to see it in pictures with these other species of bird that they are not so common, because yeah, the idea might be the same, but then yeah, because they are very big animals or animals that they stress easily, or of course that they can be hurt, it's good to have it, to have another view of it. Of course, raptor birds, not just large eagles like this one, but owls or many other. That's just a way to try to immobilize the claws, that they are the most dangerous thing, and have the animal quiet. In the right picture, a colleague is holding it for a clinical exam. Okay, so we already captured the bird. Then we need to move it to wherever we are, or to the rescue center, or maybe you are asking a colleague to do it for you because it's far away. Sometimes that happens, that somebody else captures the animal for you, and there is maybe 24 hours or more that the animal is sitting on a box in bad condition somewhere else until you actually get it. There are some things that can be done to avoid more damage, because sometimes the process can kill the animal. There are some procedures like this one. Most of the vets that has worked with vets, I'm sure has seen how to do a bandage of a wing, but sometimes not just a proper bandage, but something provisional, like in this picture, can be done by other people who is not as experienced, and can be enough to at least not have the wing hanging and during the transportation for many hours. And this can be actually very, very dangerous for the animal. So if the person can have a quick look of what can be going on, so you can of course rule out some emergency situations, and maybe do some temporary mobilization until you bring it to wherever it needs to be brought. A carton box, it's a good way to do it. It's normally not too hot. It's kind of soft, so the animal will be dark and will not hit too much around the borders. Assess in each situation if it's necessary to rehydrate. Usually it is, to do it just after capture, and then, but always be careful before the transportation that the animal tends to regurgitate. So if you rehydrate at the beginning, leave some time to them, to rest until, or because if you do it right away, a regurgitation can be very dangerous, right? And yeah, do not feed right after the capture. Is not advisable, because the animal will be too stressed and also can regurgitate. These are some pictures of how we used to transport the animals in CRAM and in the Jaguar rescue. Some carton boxes, some usual carry boxes, doesn't need any very special, but just appropriate for the animal. And in some events or some situations, maybe it's necessary to do some special things, as I will talk, I think, in the next slide. If you have many birds to transport, like in this picture, I wouldn't advise to put them together. They can harm each other. They can be damage each other, damage themselves. So unless they are babies of the same nest or something like this, it's better to have individual transportation. This is one of the special situations. It's not my picture. It's from a big rescue center here in Spain. Sometimes many animals have to be transported, and in some situations, to avoid them to hurt themselves, hurt the feathers, and make more damage, at this kind of envelope around the wings, it can be very useful to transport a large amount of animals, or even a smaller amount, but for a longer period, covering the eyes, enveloping with a blanket or a towel around the body, leaving the legs behind, and taping it around, the animal will feel okay because it's not tight, but he will not be able to extend the feathers and will be like a little tube. So that can be useful for certain transportations. Okay, so we transported the animal, or somebody else did, and we just got it at the rescue center or at the clinic. Then, as we are here, how to proceed? Okay, so ideally, as with any other animal, there is like stages, no? Like first reception facility, then a first quarantine, then like a secondary transition place, and this kind of bigger pre-release area. Not always you can have all of them at the same place, but at least the first two would be good to have it ready for any of these animals, right? So when it right comes, even if it's a marine animal, it's not that you need water or something like this. You just need a quiet, dark place for him to rest the first 24 hours until you figure out the plan or what to do. Of course, you get it. First thing is to do a physical exam to try to understand what happened to the animal, if it's very skinny, if it had some external wounds, if he can breathe okay, or has something stuck in the mouth or stuck inside the stomach and has some signs. Of course, all kinds of possibilities. And then, as you would do with other animals, you do a sequence of diagnostics until you get with the problem. Then I would say before actually getting to do all these diagnostics and taking blood and all that, it's good to, after the transportation, just observe the animal. Once you rule out that it doesn't need some immediate action and it can wait half an hour, okay, then let it wait half an hour and leave it quiet in a dark place that the animal doesn't notice you, and you can, after half an hour, observe him a little bit. Why is that? Well, because birds hide very good their mental state and their body position when in stress. And after handling, they will appear to be strong, but maybe they are not that strong. And after a little while, if you keep him in a warm and dark place, you can see that actually the animal is kind of closing a bit the eyes, the head is going low, the wings are going low because it's weak. Maybe he cannot stand on his feet, or maybe he can breathe very heavily, and then you can observe the kind of breathing noises, if he moves the tail more or the body more when breathing. So all these things, I believe, should be done before a real exam. So you let him for a little bit and you observe him, and then you can have a much better idea of how he's doing, and then you proceed with the rest, right? These are some examples of this first places that you can put the animal for observation. It can be a safe, dark, warm place that the animal will be calm with no noises, and you can observe him a little bit. Then, of course, you capture, well, you take him to weight. This is a Sula bird that also is trying to bite me, so using a towel and surrounding the wings is a good way to just handle the animal and take him out. You already teared the blanket on the scale. Using the towel, you make sure that he is dark and he is not able to move the wings. And then this is another way of weighting the animal, much maybe more tricky, but it works too. And then you proceed to the clinical exam. ideally with somebody that can help you. There is two ways to do it here. Maybe first to do it right away, at least right away you do it at the first moment, and then in some situations you need to very quickly anesthetize or sedate the animal and do it under anesthesia. Of course, as many other clinical exam of any other animal, get used to not forget anything. It's a common mistake to see a broken wing and only think about the broken wing and then forget about checking all the rest. So always go from head to toes, check everything in a symmetrical way, palpate every bone, palpate the keel, so to see how fat it is. For the people who has not worked with birds before, this is the ideal way or the most accurate way to see if it's really thin or not. You feel the bone on the keel and you touch it, and up to the left you see the shape that the muscle give around the bones. And you check under the feathers, you check the nerves, the cloaca area, under the feet, everything. One of the things that sometimes people tend to forget is the patagium. This is the name of that gets like around the elbow, I would say. It's relatively common that it's damaged in some traumatism in some birds, and fracture or a damage in this area of the wing, even if it's not in the bone, can really be critical for the animal too. And here is then to do a deeper examine under anesthesia. Would be a good idea to have different sizes of masks, so you can have everything ready if you need it. If you need with using plastic bottles and adapting it, it's more than enough. For such a small animals like any small bird, to using these big bottles for something like a pelican or something similar. You know, gas, and of course there are other methods, but gas anesthesia with birds is kind of magic. It's quick, it's safe, and it's a quick recovery. And of course you can intubate right after, so you can have a safe breathing after, right? And then you proceed to do whatever it's needed, no? So things that I would say it's advisable to do always when possible, is if it's not possible, it's not possible, but at least any new animal after the physical exam, especially marine animals, if you can do an X-ray, even if it doesn't have anything broken or anything, would be always good. Why? Because it's very common that they can eat hooks or plastics or other things that can make intestinal problems, and also yeah, it's a good information to have it if you have it ready. Of course, a fecal exam, as any other animal, and as with most of the birds, blood work is very important. If you can do chemistry, fine, but at least if you can do hematocrit and total protein and a differential in nephrotis, would be very good information, basically to compare evolution. So when the animal comes, if it's very anemic or you see some deficiencies, you can compare it every day. You can take a drop for check the hematocrit and check a little bit if it's getting better or not. So, and then of course you can do anything else as you would do with any other animal whenever it's needed. But of course, not everyone is lucky to have all the equipment, so that we leave it for whenever it's necessary. To do X-rays in birds, basically, you need to always have it under anesthesia. Without it, it's really tricky to do it. And once you have it sedated, it's very easy. You can use one of the differences is that you need some sort of tape that will not pull the feathers out. So using paper tape, it's good enough to do it safely. Do a good body positioning, and then for taking blood, it's also I would say, relatively easy once you get to do it a few times. Depending on the animal, is easier in one location or the other. I would say the jugular vein in the neck is maybe the easiest, and the one that maybe you tend to do it more often if the animal is, especially if the animal is asleep. Because it's easily located, but in the wing or in the leg, it's also a good location. Also to give to set intravenous catheter, especially animals that they are super weak and it will not pull it off, or during a surgery or something. That we talk already about it, the fecal exam, and some things that I advise to do with every or almost every rescued bird. You assume that any animal that comes from the wild, until you get it, it's at some level of dehydration, and it's a good protocol, a protocol in general, at least for me, to give some subcutaneous fluids with some electrolytes and some vitamins and yeah, things that will make him feel better. I used to use this Duffelite solution that you dilute it with serum, and you put it in the subcutaneous way. Where to do it? Okay, the subcutaneous in birds, the easiest way is between the hip and the leg. So on the near the femur and joint of the hip. Okay, it's a bag of subcutaneous space, really good, that can keep a big amount of fluid. One thing to keep in mind, one of the first times that I work with some marine birds, like pelicans, for instance, is like, oh my God, this animal has emphysema all over the body. That's what I thought. I was examining the pelican, and everywhere was like a sponge. And it's like, it cannot be. This animal has the lungs broken and has emphysema. That has to be wrong. And of course, later I understood that buffer the heat against the water when they are hunting down. They have this spongy subcutaneous tissue all around the body, especially on the front area. So that is normal. Okay. Other ways to administer drugs. Well, intramuscular, the usual ways in the right picture would be in the muscle area near the gill, or in the legs. Those both places are normally a good quantity of muscle to do it. And in the left, there is a picture for knowing the ideal location for intra-bone fluid therapy. It's of course a little bit more aggressive. I only do it whenever it's the last resort. However, it's supposed to be kind of safe. Think that the bones of the birds are very light and very vascularized. So sorry? Okay, is everything okay?
Is everything okay? It's okay. Probably one of the participants is turn the mic on.
Okay. So
you can go on.
Okay, thank you, Vita. Well, these are some maybe general advices to when working with this kind of animals that it happened to us sometimes in the past. Basically, a concern about Aspergillus that it can happen in many kinds of birds, but particularly some aquatic birds. They they have it often, and when immune depressed in the stress of captivity, they can quickly raise and make sudden deaths. So in some animals, like cormorants, for instance, that they are very delicate animals, that they don't stand stress very good. We used to do a protocol of itraconazole when coming in after some of the cases that died because of that. So maybe it's not in all the areas of the world, but at least with us it happened. So it was a good thing to do. About parasites, definitely, as many other animals, they can have a load of parasites, more or less a healthy load. It doesn't have to be dangerous, but it's good to control it for the same reason, because animal in captivity will maybe be prone to, even if they have a small amount, to make them reproduce more. And so it's good to the parasite also for the sake of yourself and the rest of patients. And I would use the same kind of treatment as other birds whenever necessary, using ivermectin or metronidazole if there are some protozoa. Toltrasuril is what I use for coccidia, and for external parasites, I used to use the fipronil. That is also common, that they have lots of flies and fleas under the feathers. Okay, so now you have the animal, the parasite already checked up, already in the first this kind of quarantine, and you already examine what's going on, and then you see that what's going on, maybe it's very bad looking. So then you have to, well, see the viability for the animal to go well or not. That, as happens with the rest of rescued animals, depending on the philosophy, on the place you're working on, if you will try to release back into the wild, or you have a colony for reproductors, or you have animals in captivity, or it's a captive animal from a collection. So it depends a lot, of course, but in this moment I will talk about animals that you rescue from the wild with intention of release and not of keeping in captivity, unless the animal can live in good conditions. So in general, unfortunately, there is little chances on certain conditions. Like the picture on the right, it was a small heron that had a broken wing, beak, sorry. Of course, there are ways to try to solve it in some animals, like we have already tried in animals with larger beaks to try to do a prosthesis. It can be tried, of course. If you can try. But in this case, it wasn't possible, and it was an animal that could not eat by itself under our possibilities at the time. So we decided to euthanize. About fractures on wings and legs, it also depends. I normally tend to try always when the animal have fracture on the diaphysis, on the middle of the bone, but when the fracture is really near a joint, then the prognosis is very bad. Of course, depending on your expertise, you can try things or not try it, but if you expect the animal to fly normal again, and the fracture is really near the joint, the prognosis is really much worse. But if you can do the orthopedic surgery, is something that in my case I had to, well, it's a little bit more in front. Well, to learn a bit in my way, but we had so many cases that actually we had to do it, and fortunately it was very successful in some cases. So don't be afraid of trying orthopedic surgery in birds. It's a scary topic, but once you learn the basics and you do it more or less following certain rules, it's not that hard, and many animals can be saved. But yeah, normally it's much better when joints are not involved, definitely. Okay, so once you have it, you need to keep the animal in a first quarantine place where you need to medicate him every day and feed him if the animal doesn't eat by itself. So one of the differential things is that these kind of birds are big, and that these kind of birds, they have very specific needs of feeding, but and also they have very delicate feet. In down to the left, you see this kind of material that is actually good enough to avoid him to damage to do the pododermatitis. Also, as with, I would say, all the other birds, when sick, keep them in high temperature so they don't lose heat, and they keep comfortable, and keep them dark and quiet. These are some pictures on the right in the case of babies, while some parrots. Down to the right, there is a baby toucan, if I remember okay, in an incubator with some animals that they have difficulty breathing. Of course, if you provide oxygen, will be necessary. Particularly with marine birds, after these first 24, 48 hours, you need to put them in a place where the animal can start feeling better. That's one of the things that other people could have ready, just in case would be necessary to have it. Depending the animal, you will need some kind of installation or some other kind. These are examples that we had in CRAM in Barcelona, and were good enough for, in this case, it was up to the left, a cormorant, for the animal to keep it in access to water, that he could go to a shallow kind of water and eat there, and then stand in a soft artificial grass surface. These are pictures from other rescue center in Torreferrusa, that they have this kind of baby swimming pools for babies, that they can be a good tip to adapt them to birds. You put a net over it and a surface so they can actually have some rest area, but especially for pelagic birds that they are used to be most of the time in water, and you can have them like this. Thing to be that is very important here is that, okay, this is very beautiful, but when the bird can be waterproof. Many sick birds, they are not waterproof because they cannot clean the feathers properly, or because they have wounds or broken feathers. A bird that is not waterproof, it will be very, very tricky to make him be, but maybe a facility like the previous slide, but will be very important, because otherwise the animal will soak with water under the feathers and cannot float, and definitely will not make it. So these are images for animals in good condition, in much better condition, in the last stages of rehabilitation. Some other examples of not particularly marine birds, but basically examples of adapting yourself or your place to the animal that you have, depending the needs and the biology and how they will feel more comfortable. These are case of toucans that definitely are not marine birds, but examples of third or last stage rehabilitation process, so they can have some place to fly a little bit, to eat more or less normal, and to muscle up, so they can after that be sent to the last resort of facilities, like flying facilities like this one, and be released. Okay, we pass on to feeding. Feeding can be tricky, but one of the trickiest things is to get fresh fish in the with the animals that they actually eat fish, but at the beginning your needs will be to make him recover some weight probably. So at the beginning you will need to assess if you need to force feed or not. Maybe at the beginning, if the animal is not especially thin, a good thing to do is to offer food and try to see if the animal eats. In marine birds, normally think that they will probably not eat pieces of fish that is already cut. You can try, but not necessarily right away. And a good advice is to tease them a little bit. I'm not sure if I have pictures of that. Well, with a small bluefish wet in water and leave them there and try to play with them with a longer forceps to see if they can actually bite it. And once they recognize that fish, with some patients, animals may start eating, or just leave the animal by itself. And if he is active enough, probably he will access to a small bowl of water with a smaller fish in water. If not, then we need to proceed to force feed. At the beginning, you can assess, depending the situation, to do tube feeding with a porridge or forced feeding full fish, right? If needs to be done with a porridge, well, you don't need to necessarily use fish, but you can use diet for animals that they eat protein, basically ate the kind of cat food porridge mixed with electrolytes can be something good to start with. Using this kind of plastic tube is actually good. Just remember, some of the birds have a pouch, a crop, some don't. Marine birds often don't. So try to understand what kind of bird you're dealing with to feed it in one way or other, right? If you need to force feed the fish, it's actually not difficult. This is a video of doing it, maybe not the most successful video, but will work. To have the bird under your arm, surrounded by towel, so that he will not move. You extend the neck up and you open without fear the beak and try to push the fish deep inside. Maybe in the video I didn't do it deep enough. In this second fish, I think it's more obvious. You can actually, without fear, put the finger deep inside, so it's actually in the esophagus, and the animal then will tend to eat. You keep the head a little bit up, because often the animal will tend to regurgitate the fish right away. So give some time until the animal swallows, and maybe you can do it slowly, give 2-3 fishes, and then leave it rest. And if the animal will not regurgitate, come back later and give some more. These are other examples of what I said, not with a marine bird, but the idea is this one, right? This is a very beautiful pygmy owl that you can offer food. That's the first, that's the animal just arrived. So it's eating from the hand after a few minutes of having him in the clinic. So yeah, animals adapt quickly to us sometimes if you manage to keep them with low stress. So you can try the same situation with giving fish. We tried sometimes with pelicans that just arrived. In minutes, we offer fish and they are hungry, they eat fish right away and they take it from the plate. So it's amazing. Then it's another situation of maybe animals that they stress a lot, like the hawks. You can put a piece of, in this case, chicken there for them when the animal feels quiet enough to eat. Okay, so now we start in the last part of the presentation. That is just some examples of some common problems that we had. This list is just very common causes of income. So, or more than causes, like situations that we find. So many times it's like, I don't know what happened to this bird. It was found somewhere, no flying, I'm very skinny. Also hit by something, hit by often cars or windows. Electrocuted is very, very common too, unfortunately, depending on the areas. But now we are talking about marine birds, so in this case, not that much or almost nothing, maybe some seagulls or stuff like this. But it can happen, and it's good to keep it in mind that can happen too. What is actually very common is interaction with nets and hooks that fishermen intentionally or unintentionally happen to make the animal entangled, or the animal maybe eats a piece of hook with a line that is out of work, just floating around. Another very common problem we'll talk a bit is animals that they got impregnated with oil or petrol. Of course, some infectious diseases, some problems that we make the bird have after having it in captivity, taking care of orphans, animals that they are confiscated from illegal trade, foreign bodies, contamination. Okay, of course, we don't have time to talk about all of them in depth at all, so I will just talk about a couple of them that I find significant, okay? And before all, just a quick overview of things that most of the people who has to deal with birds will maybe have to do at some point. Is one of the few things that with very limited resources, you can help a lot the bird. So it would be good, everyone who has to work with birds, to learn how to do this sort of, it's called aid bandage for immobilizing wings. And other kind of bandages, especially for the ones that affect the feet, like bumblefoot or pododermatitis, this kind of bandage in the left, and of course other kind of more regular bandages like you do in other animals, like in the right. A good advice that is not in the slide is that adapt the bandage for the size of the animal. In a exotic animal clinic, for instance, we often get very small birds, so animals below 100 grams. So all these sort of animals, maybe it's better not to use traditional way of bandaging, but we often use just paper tape that is much more light, and for their strength is strong enough. So with paper tape, you can do good bandages, even using paper tape and a little dental stick or something. You can do a good fellula, fixing a bone fracture. So just to adapt to the kind of animal that you are dealing with, right? Well, about broken bones and so on, we already talked about that. Eye problems are very, very common, unfortunately, and is one of these deal breakers for knowing if the animal can or cannot be released. And it's not mathematic. It's not that every damaged eye is not non-releasable, not at all. It depends on the species and even depends on the individual. Some individuals adapt to hunt or find food with one eye, but this is a complete other topic, and it has a lot of things to talk about, to how to train the animal or to see if the animal adapts to hunt or to take food with one eye or not. And this way they tell you if you can release him or not. About the broken bones, these are the cases that I was showing before. Talking about, sorry. These are just examples of some orthopedic surgery that I learned to do, and fortunately it was after that very useful. We did it very often, and once you lose, you are not scared anymore of the procedure, then you can actually help lots of animals. This is an owl case. Doing external fixation, it was a good way to to do it. This is another AWOL case that also both of them, they were successfully released after that. So yeah, don't be afraid. The worst case scenario is the animal dies. So, okay, if the animal has to die, try and learn, because maybe sometimes you will actually save lots of lives with that, and it's not as costly as internal fixation. So you don't need all the plates and all that. Just with some investment on equipment, you can do lots of things. About the fishing interaction, of course, we already talked about it. That's why the importance of X-raying, if not obvious, it's not easy, because most of the times the animal is already in bad condition, but sometimes you can successfully remove the hook and save the animal. And few slides about this that I think, if nobody ever talked to you about that before, it's like yeah, something that maybe you are unaware, but can happen everywhere, anytime. It has happened already dozens and dozens of times, unfortunately, all around the world. And you think that it will never happen to you until it happened. And it happened in Spain in 2002. That one of these damned petrol vessels broke and released tons and tons and tons of petrol on the coast of Portugal, Spain, and France. And thousands of birds were affected. That happened in many other countries. And my idea with these few slides is that if somebody can have some sort of preparation before, or think, what would we do if that ever happened to us, then you will save lots of animals. If in this case, it was a disaster that impregnated all the coastlines from 3 whole countries on the Atlantic side. And it's calculated that has affected about, over 100,000 birds. Among them, over 23,000 were received in the temporary rescue centers that they were adapted for the occasion in 2002. And among them, only 6,000 arrived alive. And there was a huge work for hundreds and hundreds of people that from many rescue centers were there, moved there to help temporarily during the month that happened. And among the 600 alive animals that they were received, only 600 were recovered and released. So talking about total numbers, it's barely nothing, but it was a huge effort, and many of these animals are endangered, and it can happen anytime where you never would expect that would happen. So I will just tell you very briefly how it was organized. There were volunteers from all over the world that came to help to remove petrol from the beaches and to help to the reception and rescue places. They were set 8 reception places along the small part of coast of Spain that was and that is in the picture, that is in Galicia. South of this picture is Portugal, and right to this picture is France. So it's only about the north west of Spain, right? In these temporary sets, it was like military organization. They were a very clear organization of what's clean area, dirty area, and were moved lots of tents and generators and places to bring dry, hot water, dry, hot air and hot water. That is actually very critical for saving the animals. To make it short, basically it was a chain where the animals were first admitted, done a very quick checkup where all of them took the hematocrit, the total proteins, and the weight of each animal and general checkup. If the animal was already very bad, was decided to euthanize. If the animal had some chances, they were passed to the section of stabilize the animal, and starting the cleaning. And the cleaning of an oiled bird, it's a hell, because it really takes a long time to remove all the oil. And once you think it's all done, you put it on clean water, but you leave some oil behind, and all the water will be oily, and then right after, all the bird will be oily again. So it's really tricky. Basically, I will not go into depth, but basically first clean the areas that they are vital for the animal with some kind of soap for taking the grease, the fat out, around the eyes, around the mouth, inside the mouth, around the cloaca, around the ears. And then once this area is kind of clean with hot water and soap, pass to the next stage to keep the animal warm and to slowly keep removing the rest of the petrol, until this is kind of that has been repeated dozens of times to each bird, until you find it like this, that is actually a clean water and clean bird, right? These are some pictures of what was done only for the occasion. That was a temporary rescue place for the occasion. That was amazing. Now, after 20 years, to think about what was done, it's actually amazing. Only to save 600 animals, but everyone who was involved learned a lot about it, and yeah, I think it was definitely worth effort. And I tell you all that so in your own circumstances and countries, try to imagine what would happen if something happened near where you are, and how can you deal with it, or at least for a small number of birds to be able to get them rescued and clean. Okay, I will not talk about in depth about orphans, because it's a whole different topic, but just two main ideas. One is that not every orphan found in the wild needs to be rescued. So there is many ways to do it by basically observing and contacting with people who actually knows about the species, to know if the animal needs to be rescued or not, and often is not. So before just taking the animal, it's always good to make sure. And second is that even when the animal is actually rescued successfully, some people believe, no, a rescued bird orphan can never be released into the wild because the implantation. Well, the idea is not wrong. Of course, birds get very implant, but if you work properly and you adapt to every species, this is a case of one of the many, many toucans that we raised from orphans and released successfully. So it can be done. It can be done. This is a rescued and released toucan that was eating from the wild, and we were observing him for many, many times. And last slide, very, very important, not because of the last one, because it's extremely common that there are problems that we cause. They don't come with this problem, but they develop this problem in your facility. So be very careful with the feet, basically. Not just putting the rings on the legs, that also can cause lots of problems if it's done not properly, but with the bamboo foot when the perches and the soil is not adapted to each animal. So be very, very careful. And yeah, terima kasih semuanya.
Oh, thank you, Dr. Ferran. It's very interesting presentation, exactly.
Thank you.
Yeah, and before we are going to a discussion session, Dr. Vino probably have something to share with us. Are you ready, Dr. Vino?
Yeah, can Dr. Ferran please end share or stop sharing? Okay, thank you.
Okay.
Not yet, Doc.
Now?
Yes. Okay. Yeah. Yeah. Thank you. So we will have some advertise, so you can sip your coffee or maybe tea or drink a break for a while. So I'm gonna
Okay.
share your intro video.
Ok. Ya está, pero van a hacer unas preguntas ahora. Que van a hacer unas preguntas ahora.
¿Qué tal?
Espera, que me están escuchando. Hola.
Yeah, Dr. Dita, please lead the discussion session. Thank you.
It's done? Okay, thank you, Dr. Vino. Okay, so recently there is a 7 question for you, Dr. Ferran. And the first question is coming from Dr. Nima Deverawati. And the question is, what kind of drugs that you usually use during the transportation?
Well, during transportation with the birds, honestly, just rehydration, something like maybe painkillers. If depending the situation, I can imagine you can give the first shot of meloxicam and subcutaneous fluids until you actually can examine better. In my case, I never use sedatives or other kind of tranquilizers or something like this. But yeah, I think basically try to remove the pain and reduce stress and rehydrate the animal are the ones who I have maybe used more.
Great. Okay, thank you. Second question is coming from Dr. Ghazi. The question is, in the dark resting room, is the masking phenomenon will be disappear?
The masking.
The masking phenomenon.
Sorry, maybe I can you explain better, please?
Masking phenomenon. I'm not really sure. Maybe Dr. Ghazi can explain to us about the question?
Dr. Ghazi. Wait.
Or maybe we can't like.
Yeah, I'm not familiar with the term. Sorry, maybe it's the language barrier because you know I used English is not my first language, so maybe I'm not familiar with the term. I'm sorry.
It's okay. Neither do I. No worry, Farron. So okay, so probably let's see what's the masking means cover the eyes with towels. Masking the sign of sickness. The sign of sickness. Oh, so probably what is Dr. Ghazi means is usually the wild birds is masking the sign of sickness. So
masking. Okay.
the masking, masking the sign of sickness. So if we put those birds into the dark area, is it, you know?
Okay, yeah, I get it. Well, I think to actually let the animal show it better, I think it's better to put it in this dark area, but not completely dark, just just dark in the way that the animal feels comfortable and is not aware of our movements. And then you approach and you can, of course, maybe light up a little bit to try to see how he's breathing and so on. But yeah, sorry, I didn't understand the word at the beginning. But yeah, I guess you adapt on its circumstance, but is just relatively, as much as possible, reduce stress for the animal. And the idea of the observation is to try to see how the animal really is. That normally, yeah, you don't see it when the animal is very alert.
Okay, great. So another question still from Dr. Ghazi. Dufallet is consists with vitamin B, which is not allowed to injected subcutaneous. So could we do that? Like injected the Dufallet subcutaneous?
I'm actually I always have done it, honestly. Maybe I've done it wrong all my life, but I think in the bottle it says that it's okay to do it subcutaneous, if I'm not mistaken. But yeah, maybe the doctor is right, but it's something I always done and never had a problem. But maybe I don't say maybe I've been wrong.
Yeah. So probably in different country there is a different products that can
or
use
maybe
in a
he's
different way,
right.
right?
Maybe something to check. I will check and come back with you.
It's okay. Thank you so much. So the fourth question, Falcon Medicine says that the aspergillus is resistant to itraconazole. Do you have those same experience?
Who is resistant? Sorry.
The falcon. Falcon is resistant to itraconazoles.
I don't remember right now. I guess in each species, you try to make sure to consult carpenter book that they know a lot. And when you face each different animal, you make sure that in the species what is recommended. I wrote itraconazole as a general first use antifungal, but yeah, of course, in each different species, you have a quick look of the references and make sure that it's okay. And if not, I'm sure in the carpenter book you can find alternatives.
Okay, great. So the fifth question. How to reduce stress during transportation and a new location from Dr. Samsu?
During the transportation, well, one of the things is that to try to transport in a carton box or in a dark, secure area, ventilated, that is not too hot, and reduce the noise around, is the basic idea. But of course, in each individual and each species, you try to adapt to it. If it's an animal that will not stay quiet, that is hitting the box all the time, you stop and you take it and maybe do one of these proper bandages, and it's better to have it with a wing bandage and kind of restrained than hitting the box in the car.
Great. So probably the operators who are doing the transport or doing the rescue should know exactly what they should do, isn't it?
Yeah,
Like
the thing is that sometimes that's not possible. So many times somebody tells you by phone what's going on, and you cannot really do it. To do a bandage by people who never has done it, I don't think it's advisable. So maybe just a carton box closed and a little bit ventilated and drive safely can be maybe the best idea.
Great. Okay. Next question coming from Eko Wijayanto. He is a student from Brawijaya University. What problem we must notice from oil spill in marine or shore birds?
Well, unfortunately, it can have a lot of trouble for the animal, external and internal. External, if it goes, I mean, it's very, very irritating, the petrol, right? So it makes like kind of burns on the skin, and the eyes can be severely damaged, the ears. That's one of the big problems. The other is that, of course, affects with the feathers, and that affects the thermoregulation. So the animal, if spends covered in oil for several hours, especially in a place that is a little bit cold or wet, it will not be waterproof, so it can definitely sink and also be very, very, very cold. And secondly, internally, if the animal swallows some petrol, it also can be very toxic for the animal and provoke many digestive and toxic problems.
Cool. Okay. So another question from Dr. Kapur. What are the most common fatal disease in the wild seabird and shorebird?
Well, as infectious diseases, basically the similar ones to the ones that affects to the shorebirds, like botulism or this kind of Clostridium disease, and well, of course, other sort of infectious diseases that affects land animals. But I don't think there are some specific for marine birds that I have faced. Honestly, in my experience, I basically have found big mortalities due to human interaction more than with infectious diseases. And a part of the botulism, that is something we already found and is relatively common. But when you get a large amount of animals, usually is for some kind of net or toxicity due to some kind of human interaction or fishing nets, so on.
Okay, cool. Okay, next, coming from Dr. Combo. Dr. Combo is one of our like fascinating bird veterinarians in Indonesia. It's really interesting. The question is, have you ever have an experience with a birds who have a problem with plastic? So marine birds with the plastic problems, and what is the treatment, and what do you think about the micro minerals that the birds got on their intestinals?
Unfortunately, sometimes. Yeah, sorry. No, I thought.
Okay, I'm gonna finish this just a little bit. And about the issues about the sea trashes, what do you think?
Yeah, unfortunately, something very common, and yeah, we found a lot. But you know what is something that unfortunately we find more often in necropsies than in as a real cause of animal that just came in. Many times an animal that died for this or other reason, when opened, we found on the stomach or on the digestive tract some smaller pieces of plastic, unfortunately. And when the animal is alive, sometimes we found animals that got entangled with pieces of plastic, especially fishing lines, but others too. And the problem with the microplastics all over the marine animals, it's a big problem. But to try, in my experience at least, to try to diagnose it when you get the animal, sometimes it's not so easy. So unfortunately, often is something you find afterwards. If it gives you signs of obstruction or toxicosis, and sometimes you can do an endoscopy, or it can be seen by X-rays. Maybe you are lucky, but unfortunately, it's not the most common thing, at least in my experience.
Great, very great. So another question from Dr. Ghazi exactly. What material do you suggest to treat and wash the marine birds contaminated with oil?
With oil?
Yeah, oil spilling.
Yeah, there is like a commercial kind of soap from here that is the one that is especially good to treat to take the oil out, and normally is how I learned to do it. With warm water, a lot of passes with soap and to do a good dry with hair dryer, and repeat and repeat and repeat. Is sometimes using smaller tools like this. Sorry, English word. Well, smaller tools to try to remove it. But yeah, that's the how I use it with this commercial soap called Fairy.
Okay. All right, great. So another question coming from Agia Wafa. About the disabilities from the marine birds, like breaking beaks or fractured on the leg, which is cannot be fixed by prosthetic, is it still can be released or not? And how the assessment if they are released on that condition?
Sorry, Dita, I need to have a quick break because I'm getting a call from the clinic.
Sure, go get it. Yeah,
Give me
please.
at least 2 minutes.
Sure.
See?
Istirahat, guys. Bentar, guys. Emergency.
Yeah, I think yes, it's emergency call, so we're gonna let him with his time first. And we also would like to say thank you, especially for the international participants that kita. So this is the first time where we have the international participants. They are Dr. Mehrat Ghazi and Farbot Kakur from Iran, and as well as the Dr. Megan from India. Wow, thank you for joining in our Meet Dr.Ferran show from the Dr.B Pet Show Indonesia. Thank you, and we would like to have your colleagues more and more from veterinaries in India and Iran to come along with us to help, especially Dr. Ferran, with his struggles to rescue animals around the world. Yeah, around the world. Sama-sama, ya, Dr. Mehrat. Thank you. Shukran. Wow, so many international participants know the bahasa Indonesia. This is cool.
And you're so happy, you know.
Yes, very happy. And mungkin sekalian juga to let you know for the colleagues in Indonesia and international participant, if you want to join us in the Vet Seminar, we call it the Vet Seminar program ya. Vet Seminar itu adalah tentang envenomasi hewan kesayangan dari hewan berbisa gitu ya. Dan pembicaranya ya ada di depan kita ini, moderator kita, dokter kita, dan besok kita akan blast informasinya. Namun walaupun belum pernah di blast, tapi sudah mencapai 30 peserta. Jadi sisanya tinggal 70 orang lagi karena hanya mau di Zoom 100 orang. Oke, jadi yang belum mendaftar segera saja karena webinarnya ber-SKPD. Oke. So Tita, please. No, that's fine.
Hello.
That yeah, I'm on emergency call from the clinic that I'm working now, and yeah, they call me for a bird. That
you need to go there. You need to go to the emergency things.
No, I don't. It's actually they called me from a very far place, so they will not bring it to the clinic in this case. I tried to give my best advice, but I'm not sure it's going to work.
Okay. Okay, so we can go on with this. I'm gonna repeat the question. Yeah. From the
I remember about the beak and fractures.
Yes, please.
Yeah. So it depends a lot on the place the kind of place you're working on. Okay. So for instance, in the Jaguar Rescue Center, we often face these problems. If we get a bird that we cannot be released, but we know that can be kept in good conditions and the animal can be happy in our point of view and can be in good, we assess and try to get in common to try to keep it in captivity in that situation sometimes. But I understand that sometimes we also choose not to. So in some points of view, and sometimes is my point of view too, is that if the animal cannot be 100% and it's a stressful species, it's better to put it down, because otherwise it will have to be maybe 10, 15 or 20 years in very bad conditions. So it's only very specific cases. For instance, in our case, we were a rescue center where had a lot of space and a good place to have birds free without the cage and so on, in the middle of the jungle. So we had one pelican that couldn't fly, but he was free roaming in the rescue center, was in the beach very often, and was kind of a little bit tamed after a while. It can be argued that it's not possible to do that, but in this case we did it, and I think during the years that the animal lived, had a good quality of life in every case. A different situation is another kind of bird that, a heron, for instance. To me, herons are animals that do not adapt to captivity wood, unless they are babies or different circumstances. So when we get herons in this kind of problems that cannot be released, are animals that always are kind of scared. We don't want them to have them in cages. So yeah, sometimes we prefer to put them down.
Good. Okay, great. So this answer also answering Dr. Meg question also about, can animal be released with a prosthetic, and because it's need a lot of management in time, right?
Yeah, with the prosthetic, I know some places that has been relatively successful, but I believe always in captivity. To be released is a different story, because the prosthetics every now, after the months or years, probably they will need some maintenance. And it's a bit tricky to actually release it with it. But yeah, I guess depends on the situation.
True. Okay. So next question coming from Dr. Parbert. What was the real and the main reason of the death caused in a petrol disaster for the animals? And how much the low numbers of professional and rescue facilities, and the bird's condition itself?
Sorry, that the real cause of the accident of the boat, you mean?
Yes, it is.
Yeah, the real accident, it was that somehow broke the base of the boat. But the real accident to me is not that. It's the bad decisions that the local government took against the boat. Because when that happens, what is recommended everywhere in the world is to bring that boat to a harbor and close that harbor and have the problem in the harbor. But what the very clever, and I talk sarcastically, government of Spain did was to send it sea inside and say to the public that it was just a little bit of oil, which it was a lie. And after a few weeks, it was spread all over 3 countries, and the disaster was 1,000,000 times bigger. So the real problem was the decision. So I guess the prevention is the key, because otherwise it's impossible. It's every beach from the south of Portugal to the north of France was impregnated with oil, and it was only for this bad decision from the government of Spain.
Okay, so in that case, what is the reason of the death? You know, when the animal is dead, there is a death caused. So what is the death caused of the animals on the petrol disaster?
The cause of death. Okay.
Yes.
Often marine birds think as a layer of oil all over the sea, right? This layer of oil, every animal, not just birds, also sea turtles, cetaceans, and so on, but birds in particular, get impregnated on the feathers, and every bird that is floating in the sea will need the feathers to float. Otherwise, they will not keep waterproof. So most of the birds, I guess, die drowned because they cannot float because the feathers are impregnated and they cannot be waterproof. Secondly, if they manage to breathe and not drown, there are secondary problems, as we talked before: hypothermia, toxic from the gas that goes from the oil, direct obstruction of the airways from the oil, cannot hunt, and they lose a lot of weight because, yeah, they cannot fly and so on. But I guess all of that are maybe less important in numbers compared to the amount of animals that they just drown.
Okay, interesting. And what is the lowest number of professional and rescue facilities that we can do for helping the petrol disaster? The lowest number, like maybe one or two veterinarians, or
yeah, I don't know. I cannot answer that question because I guess it's never enough. But in that case, more than preparing rescue centers, that also it's always good. I think would be good that as a country, government has protocols ready. So basically, something I have no idea. I'm talking as a general idea of what I believe can be better. Like in this case, it was organized. They was directly asked for help to the United States NOAA agency that came professionals from there with tools and materials to Spain to help the organization. And then they took professionals from the main bird rescue centers of Spain and they put them together with the local government and police, firefighters, and so on to work on that. But with the preparation, I know in some places they already had some kits ready, like some kind of kits for isolating a spill, for instance, bully that can be sent to initial spill to isolate the boat and then move the boat and the spill towards somewhere, or kits that with generators, cleaning, hot water and hot air, cleaning tools and hygiene tools and all that, to have it bought and ready and prepared at least in a couple of places of the country. And then if it happens, it can be moved to there. I don't think it's worth to have it in every little place, but at least somewhere at some point, and ideally centralized by some agency, I think it would be good to have it ready.
Incredible. Okay, there's no more question exactly. There's someone who wants to throw any question. Another question, maybe? Participants?
Okay, well, thank you very much for all of you, and it's a pleasure as always, Dita, Dr.B, and everyone. And they can, if they occur some more questions, you can write me on my email or Instagram or anything. And also just to let everyone know that it's not that I declare myself a bird expert. I just talk about my experiences. So I'm sure we have listeners who work who know much more than me, but yeah, I think experiences, you do mistakes and you can learn from them. So that's what I wanted to share.
No worries, Dr. Ferran. We are really blessed that you willing to share with us your experience. It's incredible. One last question from me. Is it okay?
Of course, Dita.
Of course. Okay. So about the funding. In every country, it's really different about the funding when the oil disaster or like petrol disaster happened. When we have to do the rescue and all the bureaucracy inside, in Spain, where the funding is coming from?
In the case of the 2002, I think government destined some of these, but I don't know the details, honestly. I don't know exactly. I know some part was helped by government, but probably way after probably way after you got the resources. So I cannot answer the question.
No worry. Thank you so much. Thank you so much, Dr. Ferran. if there is no more question from the participants, so I can get back this discussion going to Dr. Bino.
Yep. Thank you so much, Dr. Dita, for leading and moderating the discussion session.
Thank
And
you.
but we also have a question from the participant whether if they can get the materials of the presentation in PDF format. Dr. Ferran?
I can try to pass you some stuff. Yeah, sure. I
Okay.
will.
Yes. Thank you. Yeah, so for the participants that have registered to the online form, will be sent with the materials from the Ferran. And also, I think we are now gaining the interest of the international participant, the Ferran, because we have Dr. Mehrat and also Farbat from Iran, and as well as the Dr. Megan from India. I think we are attracting the international participants now, and I think we from the PSO will try to collect the donation from Indonesia especially, and for the international participant will be directed to you directly. So from Indonesian participants will be gathered by me, and we will also later on will send the donation to you. So I think we will need some profiles from your rescue center in Spain or anywhere else in the world that you are working on.
Yeah,
So
that would be awesome. Yeah, sure. And especially now in these difficult times, I'm sure we can get in touch with maybe the rescue centers that maybe needed most right now, and we can make it to there. Absolutely.
yeah, because it is also an appreciation for from us to you, Dr. Ferran, that you are already gladly sharing your knowledges, your experiences to us veterinarians in Indonesia, and now we are having the international participant. I think it's deserved to you to get the donation from the colleagues around the world to help your rescue center in Spain and other else in this world. So I think we will need the
Thank you very
profiles of
much.
your rescue.
That's awesome for everyone who can help. Absolutely.
Yeah, we're gonna blast it in through the social media, and Dr. Dita will also help for this one.
Okay,
Yeah, Dr.
absolutely.
Dita. Okay.
Sure, pleasure.
Yeah. Yeah, I think that's all from us, Dr. With the Show. We're gonna have the Meet Dr. Ferran number 3 program that the materials will be still hidden by Dr. Ferran. So we're gonna let you know once Dr. Ferran had the date for the program for the show. Yeah, Dr. Ferran. So we're gonna talk more about the exotic and wild animals in the next episode of Meet Dr. Ferran. So thank you so much, Dr. Ferran Algre and Dr. Dita. We're gonna
Thank you.
say, yeah, good afternoon to Spain, and good evening, good night to the Indonesian participant. So have a nice weekend, have a good rest, and we'll see you later. Thank you.
Thank
Thank you,
you.
everyone. Thank you, everyone.
Thank you, guys.
Terima kasih, Dr. Dita.